first thing is that the corpus callosum is a fiber or a series of fibers that connect the two sides of the brain, the left hemisphere and the right hemisphere. And there's actually 200 million wires or axons that cross from one side to the other that connect the two hemispheres, the right and the left hemisphere. So there's a lot of children who are born this way without a corpus callosum. The corpus callosum is not formed, and actually those fibers, when they try to cross the middle to go from one side to the other, actually get rerouted and go to different places. And if they do that, those rerouted fibers have a specific name, and they're called Probst bundles. So in children who just have these Probst bundles and who are missing their corpus callosum, the outcome usually involves some sort of developmental issues. It can be very, very mild, such as problems with reading, maybe problems being socially sophisticated in settings, and some of those kids can actually be on the autistic spectrum. And so those are some of the things that we see. A lot of those individuals, though, can have normal IQs and can hold down jobs and live independently. There are other children, unfortunately, who have more severe outcomes, who can have cerebral palsy and epilepsy and more difficulty with their behavior and with their cognitive development. So they may not be able to speak and not really interact. And so those children are on the more severe end. Usually, those children that are on the more severe end, when we look on the MRI, when we do this either when a baby is still in utero or when the baby is already born, we see additional changes on the brain. So we don't see just the absence of the corpus callosum. We see the corpus callosum being missing and other brain changes. Usually the cerebral cortex, which is the part of the brain that's involved in higher thinking, we tend to see that that's not formed correctly. And so one of the things that's important in early evaluation is to do that MRI both in utero and when the baby's born to give us a sense of the range of concerns that we might have for him or her.